Okay, so today we're going to be talking about cystic fibrosis. And in this presentation, I'm going to go in details in terms of description, signs and symptoms, causes, pathophysiology, diagnosis, management and treatment, the prognosis, the epidemiology, and the history of the disease. Okay. What is cystic fibrosis? Cystic fibrosis is one of the debilitating genetic disease that affects the respiratory system. This inherited disease affects approximately 30,000 Americans and 70,000 worldwide each year. Cystic fibrosis, or CF, is an infection in the lungs that limits the ability to breathe, and it can persistently worsen over time. CF can also affect the body's ability to digest real food. And the infection consists of thick mucus blocking the airways of the lungs, which could kill many cystic fibrosis patients at a young age. Signs and symptoms. The early signs of cystic fibrosis is shortness of breath, or wheezing, followed by persistent coughing, which could indicate dry or coughing of mucus. And there is also frequent lung infections such as pneumonia and bronchitis. These develop as the accumulation of mucus in the lungs provides the ideal breeding ground for bacteria and other microorganisms. The next sign is poor growth or weight gain in spite of a good appetite. These are directly associated with the lack of digestive enzymes, and their production can be blocked by the buildup of mucus. Without the means to break down and absorb nutrients, malnutrition can develop even with a healthy diet, which could starve people with cystic fibrosis. Next, we have frequent greasy, bulky stools or difficulty with bowel movements. These are caused by intestinal malabsorption because of their high fat content. The stool will float and will be exceptionally foul smelling. Constipation is also common with these symptoms. Um, and next we have very salty tasting skin. This is one of the first signs that parents may recognize at home. This is caused when the flow of water and salt in and out of the cell is obstructed, leading to excessive accumulation of salt and sweat. Lastly, we have male infertility causes. CF can be caught or develop. If you are born with cystic fibrosis, um, if you are not born with cystic fibrosis, you will never have it. However, you could be a gene carrier. Genes instruct the body on how to make proteins and where to send them in the cells in order for them to work. CF mutation affects the body's ability to make or direct the CFTR protein, which helps salt and water move in and out of the cell. The mutations can be split into different categories depending on how they affect the CFTR protein. There are 5 types of mutations. Class 1, we have shortened protein, which is a shortened CFTR protein. Class 2, we have proteins fails to make membrane or fails to reach the membrane. This results in the CFTR protein not being transported to the surface of the cell, which is required. And the most common type of this mutation is the F508 del. Class 3, we have protein that cannot be regulated. The CFTR protein forms a channel in the cell surface, and in people with this mutation, the gate at the end of the channel doesn't open and close at the right time. Next, we have class 4, which is reduced chloride conductance. This changes the shape of the protein channel so that the chloride cannot move easily in and out of the cell. And lastly, we have class 5, which is reduced protein level. This results in a reduction in in the amount of CFTR protein produced by the cell. The first three classes generally lead to complete loss of the CFTR function in a more severe form of the disease. The last two classes are mild reduction in the function of the cell. However, everyone with cystic fibrosis will have two faulty copies of the CFTR gene, and while these may both have the same fault or mutation, they are often a combination of different mutations. The exact combination of mutations, your genotype, and other factors will dictate how severe the condition is for you and which organs in the body are worse affected. Pathophysiology of cystic fibrosis. CF is caused by a mutation in the CFTR membrane. CFTR membrane conductance regulator, which is the CFTR as I mentioned before. The CFTR protein produced by this gene regulates the movement of chloride and sodium ions across the epithelial cell membrane. When the mutation occurs in one or both copies of the genes, ion transport is defected, and this results in a buildup of thick mucus throughout the body, leading to respiratory insufficiency, along with many other systemic obstruction and abnormalities. A combination of decreased mucociliary clearance and an altered ion transport allow for bacterial colonizations of the respiratory tract. Most common is Pseudomonas, Haemophilus influenza, and Staphylococcus aureus. These are pathogens that cause an overwhelming inflammatory response. Ultimately, chronic infections and this repetitive inflammatory response can lead to an airway destruction. Diagnosis. There are 4 different ways to diagnose cystic fibrosis. First one, we have newborn screening. Newborn screening is one of the standard one, and it shows infants who have a high levels of enzyme called immunoreactive trypsin in their blood. This occurs when there is an injury to the pancreas. The test is repeated if it's abnormal. Some states also combine this with testing for most common gene mutation called the delta F508. The next step is to refer the infant further testing as there are many false positive tests. This is essential taking a blood sample to check whether the infant has 2 genes that cause cystic fibrosis and or performing a sweat test. Next one, we have gene testing. More than 2,000 different mutations of CF gene has been identified. Most of them are quite rare, but a few are common, like the delta F508 mutation that is found in at least 70% of individuals with cystic fibrosis. Genetic testing can determine the exact mutation in most cases. For example, for couples who have children, genetic testing is also important as more than 10 million Americans are carriers of cystic fibrosis gene. For every pregnancy, there is a 1 in 4 chances that a child will have CF when both parents are carriers. Next, we have the sweat test. Sweat is collected from a small area on the child's forearm, and the chloride levels are measured. Children with cystic fibrosis have high levels of chloride in their sweat because of the lack CFTR prevents the salt on the skin from being reabsorbed back into the sweat glands. Next, we have measuring the nasal lining. Another way to confirm a diagnosis is to run a small electrical currents across the nasal lining or your epithelium. Different solutions are applied to the nasal lining and the electrical current is measured. People with cystic fibrosis usually respond different from the ones who doesn't have cystic fibrosis, which could later confirm a diagnosis. Anyway, management and treatment. There have been many advances in cystic fibrosis treatment. Patients can take medications to help thin and clear the thick mucus from the airways, enzymes to help absorb fat and nutrients, and antibiotics to treat infections. There are also new treatments that targeting fixing the CFTR protein alone. Okay, so the first one we have airway clearance therapy. People with cystic fibrosis need to perform airway clearance therapy, or ACT. This can be done using a manual chest physical therapy or a device worn over the chest that helps clear airway secretions by shaking the mucus in the airways, enabling you to cough it up. And another portable mucus clearing device involves breathing through a mask or a mouthpiece. This device forces you to breathe out with more pressure, dislodging mucus in entrapped in the airways. Next one, we have mucus thinning medications. A nebulizer or inhaler is often used before performing ACT. Commonly used medications are albuterol, that relaxes the airway and helps clear the thin mucus. And next one, we have enzymes and nutrients. Pancreatic enzyme replacement therapies help the body absorb food and necessary nutrients. Enzymes have to be given before every meal or snack. People with cystic fibrosis also have to take certain vitamins that are absorbed with fat. Additionally, additional salt needs to be provided in a formula or food. And we have antibiotics and anti-inflammatories. Antibiotics are frequently needed to treat bacteria that grow in the mucus. This can be given in 3 ways. We have orally by mouth. This is the easiest and cheapest route. And we have by inhalation. This is the most expensive but very effective. Lastly, we have intravenously or IV. This is usually reserved for those who are sicker. Anti-inflammatory medications have also been found to be helpful in cystic fibrosis. 2 medications are currently in use, which are azithromycin, an antibiotic that's used as an anti-inflammatory agent, and also ibuprofen. Lung transplant. Though cystic fibrosis has no cure, a lung transplant is the only definitive treatment available for patients with a severe bronchitis and end stage of lung disease. The median survival after lung transplant for children is 4.7 years, and for adults it's 7.8 years. Prognosis. In the past, cystic fibrosis was thought to be terminal childhood disease. In certain countries, Canada and Italy for example, the number of adults over age 18 with cystic fibrosis is greater than 60% of the total CF population. There is a direct correlation between a decade a patient was born and their survival rate. The median survival for the patients with cystic fibrosis has increased to age 40, and it is slowly rising, and it's predicted to be 50 years for children who are currently diagnosed with the disease. Next, we have epidemiology of the disease. So, cystic fibrosis is a common genetic disease within the white population in the United States. The disease occurs in 2,500 to 3,500 white newborns. However, cystic fibrosis is less common in other ethnic groups, affecting about 1 in 15,000 African Americans and 1 in 31,000 Asian Americans. The history of the disease. Earliest reference: text from Middle Ages linked to salty skin with damage to the pancreas. Infants with these signs were believed to be victims of witchcraft. However, the first modern description of the disease was made in 1938 by a pathologist, Dorothy Anderson, based on the autopsies of the children who had died of malnutrition. She termed the disease cystic fibrosis of the pancreas. It had previously been known as the mucoviscidosis, referring to a thickening mucus. Establishing this diagnostic criteria. In 1963, a panel of experts commissioned by the U.S. Cystic Fibrosis Foundation wrote a guide for diagnosing and managing cystic fibrosis. At the time, sweat testing had become the primary method used to diagnose the disease. Excessive salt in the sweat can dictate the presence of the disease, and this test is still common use today. We also have gene discovery, the earliest gene discovery. It wasn't until 1989 that the CFTR gene was discovered and linked to the disease of cystic fibrosis. Knowledge of the CFTR gene and its mutation made diagnosis much more accurate. Scientists learned that a specific deletion of 3 base pairs of the DNA and at the position 508 of the gene accounts for about 70% of cases of cystic fibrosis. This mutation is known as the F508 del. Survival improvement. According to the studies that the Cystic Fibrosis Foundation Patient Registry established in 1966, survival has increased from barely six years in the 1960s to about 37 years in the 2000s, with an average increase of 1.8% per year. Experts anticipate that this lifespan will continue to rise. And lastly, before I end this presentation, I found some research on, if you're into music, there is Frédéric Chopin. He was the greatest composer of solo piano music and is a gifted pianist. He had a disease that made him sick from early childhood, and he died at the tragic age of 39. He was diagnosed with tuberculosis, but his autopsy showed none of the signs of this well-known disease. A noted pathologist named Cruhier performed Chopin's autopsy and wrote that Chopin's illness is a disease I have never encountered before. Chopin's symptoms indicates that he probably suffered from cystic fibrosis, a genetic condition that was never described until 1938, 90 years after his death. And that concludes my presentation. Have a good day.